Hey mama, welcome to my channel. I'm Dr. Carmen, a pre and postnatal chiropractor and a mom to twins with a third on the way. My goal is to empower you to thrive at every stage of motherhood. Whether you're looking for energizing workouts, soothing stretches, or tips on how to elevate your overall well-being, you've come to the right place. So let's dive in and create a little time for you because we both know you need it. Let's go. Diastasis recti, also known as our mommy pooch, occurs during pregnancy when the outermost layer of our core separates to accommodate our growing baby. Now, this term should not be looked at as pathological. It's actually a very normal process that happens in pregnancy. Believe it or not, every woman that makes it to the third trimester will have separation. However, some just heal a little faster than others. About 80% of women will actually heal within 1 year of giving birth, whereas the other 20% need to work a little harder to heal things. The good news is that you can heal that separation with exercise, but the key is not only consistency, the key is also using the correct exercises that are actually targeting and strengthening the deepest layer of your core, which is your transversus abdominis, so that the front layer of your core, which has separated, can heal. So you want to avoid doing any crunches, any sit-ups, any planks, or any twisting during this stage of healing. And if you haven't already, be sure to get assessed by a certified healthcare professional to be able to see if you do have diastasis recti and the severity of it. After all, I like to call our core the powerhouse of our body. We use it every single day in every move that we do. So it's very important to be functioning optimally, because if you have weakness in your core, it can actually cause pain and instability in surrounding areas. Let's look at some of these exercises that can help with your diastasis recti.
When performing diaphragmatic breathing, place both of your hands just under your ribs, pointing towards your belly button. On your breath in through your nose, you should feel your hands separate. And on your breath out through your mouth, you should feel your hands come together. Once you have this down, try performing a Kegels during your breath out. To perform a pelvic tilt, it's almost as if you're bending your pelvis up slightly by flattening your back against the floor and tightening your core muscle. Hold each pelvic tilt for 3 seconds. Keep in mind that you can also perform pelvic tilts while standing. To perform a proper glute bridge, be sure to pelvic tilt before you start. Once in position, interlock your fingers over your ribcage. Now perform a glute bridge. You really don't need to go too high here. In fact, if your fingers start to separate, that is a sign that you've gone too far, and that can actually place strain on your lower back. To perform a heel march, be sure to pelvic tilt first, perform your glute bridge, and now lift one leg at a time. Try and keep your pelvis steady. If you find this difficult to do, try heel slides instead. Now keep in mind the floor was very sticky here, and so my heels were not sliding easily. And there you have it. Try to keep consistency in completing these exercises for best results.